Please welcome our host for today's discussion, Daniel Stach, Czech TV professional, member of the science department of the Czech TV, host of programs Hyde Park Civilization and Science 24. He's interviewed the most distinguished scientists in the world. Daniel Stach.
Imagine. Please imagine you used to play piano and do ballet. You love snow, and you learn to like the long, dark winters in Sweden. You were born in France, but you spent half of your life abroad, and you spent hours and hours and hours and hours doing fundamental research to figure out how bacteria defend themselves against attacks of viruses. Imagine that you use this fundamental knowledge to create a tool that can change the world, a tool that can literally change the humankind forever. You created molecular scissors that work much like a text editing software. A text editing software can find a typo and edit it, delete it, change it in a document. Your molecular scissors can work with the book of life. Change the DNA. Just imagine all the possibilities that you just opened up, helping to treat diseases, help to adapt to climate change, as well as, for example, fighting the microbial resistance, but also all the ethical questions that just came up. Imagine all this together and add that personally, you are very nice and very cool. Now, thanks to the ESET Foundation, you can stop imagining, because you can meet in person the one who made it all happen and who connects all the dots. Ladies and gentlemen, please welcome the co-creator of CRISPR-Cas9 technology, the head of the international jury of ESET Science Award, the Nobel Prize laureate, Emmanuelle Charpentier. Thank you very much for joining us.
Thank you.
Welcome.
Thank you. Thank you.
Thank you very much for joining us here in Bratislava.
Thank you. This is a great pleasure for me to be here.
Please tell me, how did monasteries, piano, and ballet influence you to be the successful scientist you are?
I don't know, but I guess I guess you can find in piano, ballet, and the idea that I had at when I was around 15 years old, this idea that I could be a detective and that it was interesting to consider to spend some time in a monastery as very close to what what is to be a scientist, in the sense that the skills of that I learned during learning classical piano and ballet, that is work, lots of repetition of tasks that may sound quite boring, but are necessary to get better in the discipline. As a matter of fact, a lot of discipline, a lot of will, and in the part of being a detective, obviously a scientist is a kind of a detective, right? And the idea to spend the interest of finding kind of, interesting to spend some time in a monastery. This is obviously a life of a scientist, spending a lot of hours in the lab and often alone at odd hours.
What about the influence of your parents? Because you said about your parents that, quote, they let me do what I was wishing to do. And I was actually quite serious. That is what my mother would mention, that she never had to say anything.
Yes, this is what she says, and this is also what my father used to say. But I have also two older sisters, so in a way I was following them. I was obviously maybe quite inspired by their journey. And as a matter of fact, it seems like I was quite an easy kid. And that, yeah, I was relatively quiet, but quite happy and quite determined. And also I knew what I wanted, in a way. So my parents did not have really to influence, and it was not really their style to push. And I guess I was pushing myself enough that, you know, they did not feel that they needed to push further, which I think was a good strategy.
Is it true that you decided that academia is the path for you when your sister, the oldest one,
yeah,
went to the
because I have
university?
nearly 12 years of difference with my oldest sister, and when I was in primary school, she was entering university, and I thought it was interesting to see that actually one could spend a life at the university, because I had understood that she had teachers that were also doing some research. And so I found interesting that one could fulfill her or his life through really teaching others, but constantly learning and also researching and, you know, exploiting her or his own curiosity. And I think I understood this quite early on, and I have to say that I was trying to go very fast up to the point to reach university. Also because I guess my parents, who were born at the end of the 20s of the last century and beginning of the 30s of the last century, could not really study at the time, did not have the possibility to study, and yet I guess they would have had a lot of you know, great capacities to study, and they were a little bit frustrated in this regard. And I guess I found that, you know, I had the privilege to do so. And so I had to take really this privilege.
And you did well. Despite you failed at least one of your classes at university.
Exactly.
Which one?
I think it was the third year of the university that I had to repeat.
It was about the names?
It was actually a module in chemistry. But then I did very good, because then I was the first of the second year. But as a matter of fact, I also think that it was, you know, yeah, fruitful, because it was a way for me to deal with the fact that I was able to deal with failure. That was maybe the issue that I had, and that I think a lot of kids and young students have, this, you know, pressure or this fear to fail. And I think it's also something that I think I learned from, because when you continue in research as a scientist, you need to learn to deal with failures, because the experiments do not always work as you wish, and you need to learn with a lot of frustrations. So I think this was maybe a good step. So I was not, let's say, proud of myself, but then I repeated the year and I had great scores, so okay, this was it. And I'm born at the end of the year, so it was not like, you know, I was already young, so I said, okay, it's still okay. I can afford it.
You describe yourself, you as scientist, quote, "I'm curious, persistent, and always trusting in my instinct that I have to concentrate on the basic science, and the rest will follow eventually." But you were not working just in a lab, you were also working with doctors, with medical professionals. During your PhD, doctors were coming to your lab to learn how to make better diagnosis concerning especially microbial resistance. And during your postdoc, you actually worked in hospitals, helping kids with cancer. How this did affect you?
I think this affected, for sure, affected the vision that I developed later on for the CRISPR project, with a vision that it could be useful to treat, for example, human genetic disorders. But this was, I think, essential for me at the period of my university time when I had to choose whether what kind of master studies I will choose. At the time in France, I had the choice between an academic master and a professional master. And at the time, there were no emails, you know, no SMS. So one had to maybe interact more directly with professors, which I think was very good. So I discussed with a number of professors who told me, no, choose the academic masters. I mean, we think it fits more your personality. And then you can always, in any case, after the master, not follow with a PhD, but find, a job in the private market. And as a matter of fact, I continued in academia, and I think this was, I think, indeed a very good
good call.
Good call.
And you love bacteria.
And I loved bacteria, but what I wanted to say, the idea for me to maybe do a professional master, is because at the time it was clear to me that I wanted to do research, but research with an application in medicine. Mm-hmm. And this was my leitmotif, and has always been my leitmotif in the different projects that I studied as a PhD student, postdoc, and even group leader later on. And I ended up being interested in bacteria. I don't know why. Maybe because my mother repeatedly told me that I think I was breaking the record of the number of infections with staphylococci between 2 years old and 4 years old, which led to removal the tonsils. And so maybe I heard enough about staphylococcus. and so I was interested in bacteria ultimately. And I think it was obviously a very good choice. But also a timely topic to study 30 years ago, antibiotic resistance, and it's still timely, actually. This is unfortunately a research that has a little bit lost interest by academic scientists and also by developers, the field of developing antibiotics, because maybe it's not rewarding enough. But having said this, it's still very timely.
Which bacterium do you like the most, and why is the answer to this question the flesh-eating bacteria, Streptococcus pyogenes?
I think this is really the bacterium that I like the most, because this is a source of the molecular scissors, so this gene editing technology called CRISPR-Cas9 that exists in multiple bacterial species. But the fact is that the CRISPR-Cas9 that is used worldwide is really the CRISPR-Cas9 from Streptococcus pyogenes. There are very few CRISPR-Cas9 from other bacterial species that can be as efficient as the one of Streptococcus pyogenes. And this bacterium, actually, it's quite remarkable. It's a strict human pathogen, and it's responsible of a wide range of diseases, and we are far from understanding the mysteries of this bacterium.
You said, quote, "I think we people are quite boring compared to microbes."
Exactly.
Why?
Actually, obviously we have a brain.
Yeah, that's a nice chance.
And it's highly complex. But it's kind of remarkable that, microbes, and in the case of Streptococcus pyogenes, the size is only 1 micron. So it's something that we cannot see with
it's 1 millionth
eyes.
of a meter.
Exactly. That actually can have developed so many mechanisms to cope with the environment. So these are, like any other macroorganism, have largely evolved over millions of years. We saw it with the SARS-CoV-2 virus. I think the population now has understood the virus that evolves into multiple variants, and we always need to develop a new vaccine against the new variant. So microbes are largely evolving, and through evolution, they have developed a large panel of mechanisms. They are encountering a lot of troubles in their lives. It's constant war with the viruses, with dealing with a drastic environment. It's like we will be ourselves confronted to all of a sudden heavy rain, a second later heavy sun, a second later heavy snow, and we would have to adapt. And we are not able to adapt to these constant changes, but the microorganisms are able to adapt through very fine-tuning of molecular mechanisms. So they don't have a brain, but they are largely evolving and able to react in an incredible fashion.
You love them, that's clear.
Yes, we learn
I
a
do
lot
believe
from them.
you would agree.
We learn a lot from them.
You said that if you are a researcher working on a topic, you should identify with the topic that you are working on. You work on a topic when viruses are attacking bacteria. Do you identify yourself more with bacteria or with viruses?
I think with, actually it's an interesting, I think more with bacteria, although I like the virus part, because once actually it came to my mind when I was introducing a scientific lecture that I was giving, that I reflected on the fact that I have been a mobile scientist, so I always invaded a country as a foreigner.
Be careful with these expressions.
And I never came back to the country, as if the country had developed an immune system against me, so that I would never go back. So in a way, I like viruses because I feel that I like to invade, you know, countries and learn from them, which also, you know, attackers do, right? To try to impregnate themselves from. But I like the bacteria and the defense systems, you know, and the immunity, because it's remarkable that every organism on the planet can be infected by viruses. Viruses themselves, some viruses can be infected by viruses and have evolved immune defense systems against the viruses. So it's quite remarkable.
To explain CRISPR system, do you want to be the bacteria or the virus?
I would like to be the bacteria.
Okay. She is defending, I'm attacking.
Yeah.
Just in this example, to explain how CRISPR works, I'm a virus that is attacking you, the bacteria. What do you do?
What do? I have actually already a molecular machinery in myself ready to attack you, and specifically your genome. And I'm able to recognize your genome and to cleave it so that your DNA cannot replicate, and yourself as a virus cannot propagate, cannot kill me.
So
and
I die.
This is actually the way I'm going to attack you, and in a way, kill you. That is.
Thank you.
Sorry.
What part of my genetic information is staying with you? Part of the virus genetic information staying with the genetic information of bacterium.
Yes, so what is interesting is that in the case of the CRISPR-Cas9 system, that is originally a defense system of bacteria, is that to be able to recognize you, I need to have a first encountering with you, whereby you are going to try to attack me, and you're going to give me a piece of your DNA, and me, I'm going to process this piece of DNA, and I'm going to integrate it into my own genome, so that I can understand that I have been encountering you, and so I can really recognize you upon a second infection. And this is during this second infection that then I will be able to attack and kill you.
Yeah.
So, you know, I need to build up a kind of strategy. I get to know you a little bit. And then, you know, I'm smarter, and then I'm going to, you know, to attack you.
This is how you learn that you are
that
you are in a world of trouble, because we met for the first time last year. So she learned about me.
Yes, exactly.
You know, so
yeah.
If I was a virus, I would be dead now.
Exactly. Exactly. But I'm a nice person, so as a
You're a nice bacterium.
As a non-bacterial organism and as a human organism, I'm not going to attack you.
But we do have to say that we have a lot of bacterial cells in our bodies.
Exactly. I think we have more bacterial cells than our own cells. But for sure, we have more human genetic information than bacterial genetic information, because the bacteria are small, but we have more, you know, bacterial cells. So scientists will say now that we are driven by our gut, the gut feeling. And this is not the gut, actually. These are the bacteria in the gut that drive us. And also provide the very good immunity that we have, and are very important for our microbiota. And you have so many research done in the field of microbiota, and so many proofs now that a healthy microbiota influences a lot the health of a human being.
You studied in detail this process, this defense mechanism of the bacteria, and you used this. You learned from nature, you learned from the struggle to come up with molecular scissors. How did you and your colleagues come up with the precise idea how you are not only scissoring, but also precisely scissoring in the right place?
Exactly. So with this research, actually, it really started in my lab, then it involved in collaborations, as often in science. This is always say this because science involves a lot of young scientists, very eager to learn and to discover new mechanisms. And we need those young scientists in the labs. They are really the ones doing the research. And as a matter of fact, it has been also really an international effort of the first collaboration with a German group, and then another collaboration with an American group. But I have to say, with 3 young scientists, the main 3 young scientists who have really done the most into the CRISPR-Cas9 discovery is a master's student from Bulgaria, a PhD student from Poland, and a postdoc from Czech Republic. But we had to go step by step. So first, understand the first step of the mechanism, second step of the mechanism. But ultimately, we understood how this machinery works in bacteria. And then ultimately, we figured out that there was a way to harness this natural mechanism, to use it as a tool that would not recognize the DNA, the genome of a virus, but that we could program to recognize any DNA of any cell and any organism, and thereby have the possibility to have a tool that can modify the DNA at will. And that ultimately led to really this technology that transformed the field of life sciences, because in contrast to a lot of genetic tools that have been developed over the past 50 and 60 years, this very CRISPR-Cas9 technology is very simple to use, very versatile, yet with a sophisticated mechanism, but at the end of the day, simple enough to be able to be used in a versatile manner and in a very easy, programmable manner.
And it is being used, actually. It's being used as a treatment, FDA approved, the treatment of blood disorders such as beta thalassemia and sickle cell disease. How did you feel when you learned the news?
I was very happy. For sure, I followed the process. So the product that was actually approved by FDA, the medicine, originates from a company that I co-founded more than 10 years ago, CRISPR Therapeutics, who joined Vertex Pharmaceuticals to lead to this medicine, and that is a combination between gene editing therapy and cell therapy, and that lead to a cure that allows to treat human genetic disorders such as blood disorders, in this case beta thalassemia and sickle cell disease. So it was a huge huge reward in any case, because I had anticipated and even written in the early days that if we could, let's say, come up to the discovery of a simple mechanism, then it would be very attractive to use this technology to treat human genetic disorders. And it was also very rewarding because 11 years ago, we had set up ourselves a goal of 10 years to have a medicine that will be approved. And indeed, it took 10 years. But it was a lot of efforts from the developers, so particularly Rodger Novak, who's actually has a Czech name, but he's German.
It's German, yeah.
But with a father who was born in the former Czech, in Germany, but former Czech, Republic in a way. So, there are lots of Czech names in a way, very so have contributed to the technology, but very much an effort of Rodger Novak and Sean Foy, with whom I have co-founded, and after, all the people who worked at CRISPR Therapeutics and Vertex Pharmaceutical, again, joint efforts of really a lot of talents in this biotech environment.
when you know the landscape of the current research, current possible applications of CRISPR-Cas9 in medicine, which diseases do you think are close to get a treatment thanks to CRISPR-Cas9?
Other diseases?
Other diseases?
I mean, you have already, actually, CRISPR is already used to treat cancer.
You mean cancer immunotherapy?
Yeah, and then this is in the context of actually an approach that was already developed years ago that is called cancer immunotherapy. So this is the ability to program, to genetically engineer the immune cells of a patient so that they can recognize the cancer cells and kill the cancer cells. So this is an approach which has been proven to be successful. And for sure, in this case, one needs to engineer the cells. And in this case, one needs a technology, and CRISPR-Cas9 is used for this technology.
What is being researched right now, for example, a treatment for diabetes, cystic fibrosis?
Yes.
These are on the table.
So these are on the table as well. Even though you have treatment existing now for cystic fibrosis, but this is why what is nice also with the field of medicine and extremely exciting with regard to all the developments taking place in academic labs, clinical labs, biotechs, pharmaceutical industries. Really, you have a lot of scientists, clinicians, developers joining forces to really tackle the disease through different strategies. And the more strategies are developed, the more also we tend to merge the strategy. Like, for example, cancer immunotherapy, it's merging the strategy of cancer immunotherapy with gene editing, or like treating human genetic disorders, cell therapy with gene editing therapy. So it's really an exciting future.
To make it absolutely clear, what's the difference between gene therapy and gene editing?
Actually, for me, there is no so much difference. It depends for what purpose the gene editing is used. I mean, the idea to edit genes is just to in a way, edit the genes. Then, with regard to gene therapy, then it's editing genes in the context of curing
so
a gene, in
it's
a way.
the tool of the gene therapy.
It's the tool of the gene therapy, in a way.
It may be in this case.
Yeah, exactly. You can also talk about, genetic engineering, so you have a lot of terminologies that are used.
There is a lot of money there on the table because this treatment can truly change the landscape of medicine. There are also patent wars right now, ranging, I would say. What role do you play in these patent wars?
Yes, so as scientists, actually, we make a discovery. So we think it can be patentable. So what we do is we go to the patent office and we file what we call an invention disclosure form that may become a provisional patent application, that becomes a patent application that ultimately we hope will be awarded as a patent. And so this requires, multiple steps, involves patent attorneys and other patent experts using a totally different language than the scientists writing their articles. So it's another language which, the scientists have to understand, adopt. The patent lawyers have to learn from the scientists. So it's a lot of interactions. I spend a lot of interactions with patent attorneys to explain the discovery, explain the research, and also when you have, interference with patents, think of strategy, go back to the data, go back also to the data in the computer that, maybe I would have, not found myself, but which softwares can find. So it's a lot of digging into the details, understanding all the details of the science that led to the discovery, and ultimately having patents. And in the case of CRISPR-Cas9, it's quite complex. The positive aspect of the complexity is that all scientists and developers were so excited by the technology when it was published by Martin Ittek, Jennifer Doudna, Christoph Zielinski, and myself, that a lot of scientists got extremely excited, and the developers knew at the end of the day, whom to approach to go ahead with the use of the technologies, whether it will be for the aspect of doing research or the aspect of developing research for commercialization. So at the end of the day, everyone uses the technology very happily, very brutally, I have to say, because they were very eager to use the technology. So people found their way in the complexity, and it did not stop the process in reverse.
So the patent wars did not affect the science and the usage of the
No, it did not affect the science. It did not affect, the applications of CRISPR-Cas9.
You said brutal. Where is the ethical line of using CRISPR in the current world?
Yes, so the ethical line, I mean, at the end of the day also, what is very interesting to mention, I started as a bacterial geneticist, so the question of ethics in the lab for me has always been natural. Because what I learned as a master student was that any genetic engineering that I will do on the bacterial species that I will be working on will have to be justified. The reason is the genetic engineering that I will be doing should not implement some, let's say, transforming the bacteria in a bacterium that will be resistant to an antibiotic that could be used in clinics, or a bacterium that will be more virulent. And we also work in very safe environments where we make sure that all the genetic engineering we do on bacteria or cells, the cells and the bacteria are not leaving the lab. So we work in very strict environments. With regard to CRISPR-Cas9, for sure, the goal was to make the technology available for the purpose of really increasing the knowledge in the field of life sciences, to make the technology available to really increase all the development of research and development in the field of medicine, and potentially develop cures. It was not meant to use the technology for application that, for example, human transformism, or changing the human germlines, even though this has been done, unfortunately, in 2018 in China. But these were obviously the risks of the technology. Having said this, this has been the risks of all the genetic technologies which have been developed over the past 50, 60 years.
When you mentioned the 2018 situation, it was the Chinese scientist He Tianhui who in 2018 announced that he edited genes of twin girls, Lulu and Nana, before birth. It was highly controversial. He spent 3 years in jail. He's now back in science, now doing research. You said about this situation that it was just an irresponsible act because he claimed that he just did it too quickly. That was his response if he regrets his actions. Do we have any chance to enforce the rules that nobody, truly nobody, would be working on germlines, meaning that nobody would be doing the changes that will affect all the future generations?
Let's put it that way. There are some guidelines that have been, written by different scientific academies in the world. And I think this is certainly a research that will not be carried in labs that are funded publicly. Obviously, this was a case that took place. Doesn't mean that it will not take place in the future. Now it's more, it's more complex than one thinks it is. Genetically modifying the germline with CRISPR-Cas9 is not as easy as modifying the genomes in other types of cells. And then for a lot of let's say, phenotypic characteristics, the characteristics are not caused by only one gene, but by multiple genes. And a lot of our characteristics, we are far from understanding the genetic background. So it's not as simple as it looks like. And it will be, very difficult for me to imagine that for a lot of, let's say, characteristics you may think of, we could actually apply CRISPR-Cas9.
But is there anything that could enforce the rules, that could enforce the guidelines. If somebody decided just to do it, does the scientific community or the international community any tools to make it stop?
I mean, the scientific community will certainly be outraged. But de facto, this is an example showing that a scientist in China obviously was able to use the technology for such a purpose.
Do you have any indication that somebody else is doing it? Working?
I don't have any indication of such.
So we can sleep well, you think?
I would believe so.
I would hope so.
I believe that I believe as well that there are more dangers on the planet right now to worry about.
Yeah. Let's think about one number. It's up to you to guess. How many people do you think die every year in road accidents in EU countries? Just think about this. Just pick a number. How many people die during road accidents in EU every single year? You have a number in your mind. Now let's compare it to your second guess. What's the number of people who die because of microbial resistance in Europe every single year? You have two numbers in your head? Just make a comparison. According to the latest statistics, every year in EU countries, 20,000 people die in road accidents. According to latest estimations, in Europe, every single year, 30,000 people die because of microbial resistance. How can we handle that? How can we help to make sure that we have antibiotics that actually work?
Yes, I think it remains a challenging issue after 30 years where I entered this field. This is challenging because every time that a new antibiotic is developed and brought to the market, bacteria, being very smart, find their ways to circumvent the action of the antibiotic and to develop this mechanism that allows themselves to resist the action of the antibiotics, which lead to the statement that we need to maintain, and I will say to increase research on antibiotic resistance, because compared to 30 years ago, there are less scientists working in this field of research. We also need to increase really the development of novel antibiotics, because the pharmaceutical industry has also left the field to focus on the development of medicine that may be more beneficial, in terms of costs, because an antibiotic is just given for a certain time, very short period, for a certain case.
It's much more, it's getting more money to...
Exactly, it's more profitable.
Profitable, yeah.
And this, it's essential that to increase the research, so in the academic field and also in the pharmaceutical and biotech field, for the reasons which I think may resonate in the public with regard to the pandemic that we have just faced, thinking that, pandemics is not for us, it's for the people of, other continents or the countries in development, and that we are, it's not for us, and forgetting that viruses have no barriers and are able to indeed infect everyone. And with the chance we have had in the recent years, the chance we have had to have a vaccine developed extremely fast through a novel technology based on RNA that resonates for CRISPR-Cas9, because there is also an RNA component in the CRISPR-Cas9 system. And how lucky we were to have this vaccine that saved a lot of people. If we were encountering a pandemic with a bacterium, it's another story, because it's more difficult to develop a vaccine against bacteria, first of all. And second of all, a treatment against bacterial infections are antibiotics. Antibiotics are given to treat bacterial infections. They are not given to treat infections with viruses. But with this issue of bacterial resistance, we really need to increase the research on antibiotics. So there is really an urgent need. Also, with regard to the fight, and we saw it with SARS-CoV-2, it's also to maintain a level of expertise in the world. When SARS-CoV-2 came to the world, everyone was, okay, where are the virologists? Where are the people who understand this family of viruses? De facto, we were happy to have scientists who were understanding very well this family of viruses, and we were happy to have also other types of scientists who had developed vaccines with this kind of new technology. So we always need to make sure that we maintain and we even increase in nowadays the number of experts in the fields which we know are challenging for the future, to make sure that we are prepared for a potential pandemic or a potential threat, so that we have the right people in place who can then gather together in terms of if there was an emergency happening, so that they can really join forces and others can join them to really find quickly a cure.
Concerning the antibiotics, how not profitable are for the pharmaceutical companies. There is the oldest joke, if you want to punish the pharmaceutical company, do not have the high pressure. Because having high pressure is the most profitable way for the companies. It's a long-term joke, not saying that there are no more profitable stuff. But you need to use the medication for the long time. You also mentioned the RNA in case of CRISPR. That's guide RNA, that is saying the scissors where to cut.
Exactly.
But most people are familiar with mRNA, with the vaccine that helped to save a lot of people during the pandemic. Is it safe? Can it change my DNA?
No, it cannot change the DNA. And I have to say it's safe because, in addition, mRNA compared to proteins are less stable. So the mRNA vaccine is based also on the technologies that the mRNA will be made stable enough so that it can be stable during the process of doing the job, let's say.
For a short time?
For a short time, but then disappears. And
that's it?
And that's it. It has done the job, it disappears.
So mRNA vaccines, no issues? No
issues. Now, like for any, this is also, I think, it relates to me, not because of before SARS-CoV-2, actually, also with CRISPR. With CRISPR came very early on this problematic, or is it safe? And I was always related to, the number of medications that people take every day without thinking, is it safe? De facto, when one takes a medicine, one forgets often to read the notice with all the possible secondary effects. If you read all the possible secondary effects, you were like, oh no, I'm not going to take this if I have this, that, and that. And most of the time you don't have, or maybe you have, but you don't know.
So, for example, the medicine against heartache has as a possible side effect heartache.
Yeah. So it's also very important to understand that we are all.
No, heartache. Sorry, headache. I mispronounced. My apologies. Sorry.
We all are.
Heartache could be something very different. Headache. My apologies.
We are all individuals, and with regard to the vaccines, with regard to CRISPR, came also in my mind the notion of personalized medicine. We talked a lot about translational research and then precise medicine and personalized medicine. And indeed, we are really in the century of precise medicine and personalized medicine. Why personalized medicine? We see it a lot for the treatment of cancer patients. It's because we can, first have a treatment of general chemotherapy, but the further treatments can be very much personalized. Why? Because we work differently now also through the knowledge of our genome. We can adapt more the medicine. And so, for sure, sometimes a patient can react slightly differently than the overall population. That is also why, when you develop a medicine, you have clinical trials. Clinical trials doesn't mean that when a drug is added on the market that maybe 100% of the patients were cured without any risk. Maybe one patient out of a large number was not cured or did not react in a very good manner. But it will not be a reason to not allow the majority of the patients to be cured.
Speaking about the possibilities of CRISPR, in this case CRISPR-Cas9, what about agriculture, for example, and helping to cope with climate change?
So the issue of climate change relies on the fact that, for sure, the climate change is a huge stress for the plants that have to adapt. And as much as microorganisms can adapt very quickly, the plants may not be able to adapt very quickly, although they learn to adapt. For example, you have a lot of research that is done in the laboratories to try to stress the plants with some, let's say, changes that one would anticipate would occur in the future, and try to select for a plant that has naturally resisted, evolved to resist this stress. And then the idea is to really figure out what is responsible for this resistance. So it's to read the DNA of the plant and figure out whether there was a change in the DNA, a mutation that allowed the plant to resist and to take this knowledge and create plants that can resist better.
The new situation, the new environment.
New situations which are to be anticipated. Also with regard to also a more, let's say, more responsible agriculture, to understand now that you need also to have the possibility to grow different varieties of crops adapted to different types of soils, depending on the strategies of the farmers to have, it's not my field of expertise, but to have as well the right plant crops for the right soil, and sometimes to change also, rotate the plantation. So there are lots of strategies that they have developing, or maybe to go back to a crop that used to be used in the past. And with precise gene editing, one can, let's say, in a better fashion and in a safer fashion than with genetic tools that were used prior to CRISPR-Cas9, engineer a plant that will be a plant that will be engineered as if no genetic modification would have been done, in the sense that it could be a genetic modification that could have occurred naturally by the plant. Because CRISPR allows to modify the plant without introducing foreign genetic material, markers, which the former genetic modifications were introducing.
So instead of just trying and finding out, successful, unsuccessful, we will know what we want to do and we will precisely adjust.
I think the questions is more, let's say the ethical questions is more, or the safety questions is more with regard to the nature of the plants to produce, rather than the technology itself that is safe and can be also controlled at the end of the process to have been safe for the plant. So it's more the nature of the modification.
At the beginning, there was the possibility to do one editing of one gene during one try. Now we can modify more genes at once. What's the future of CRISPR?
The future of CRISPR, I mean, we can modify more genes at once, indeed, but it depends also on the types of cells. There are some cells that are more refractory to easy modification, specifically modification of multiple genes. The future of CRISPR, the future of CRISPR, it's what we have seen being developed already in the past 10 years. It's always seeing CRISPR methodologies evolving because, for example, it started with CRISPR-Cas9, but the CRISPR technologies evolved by using other types of CRISPR-Cas mechanisms existing in nature other than CRISPR-Cas9. So we have multiple CRISPR-Cas mechanisms existing in bacteria. So by trying to find in nature more of those systems, by digging into the microbial world, and it's also with all the research that is done by the microbiologists to find new defense systems that are not CRISPR-Cas based, but based on other types of molecules which have been discovered lately, and to try to see whether those systems can be also as harnessed as technologies, or can, at least in terms of their nature, some aspect of the mechanisms can be taken and fused with CRISPR-Cas. So it's a lot of also, and this has been shown also with CRISPR at the beginning, using CRISPR-Cas and let's say, adapting CRISPR-Cas also based on what we were, finding and what we were using as former genetic technology. So it's a lot of engineering, it's a lot of discoveries to be done in the microbial world to always develop tools that are better, that are more precise, that can do more fine-tuning. And also all the technologies around CRISPR. CRISPR would not have been successful if it had not come at the right time, where 10 years ago we could read the DNA, sequence the genomes in a high-throughput manner, when we could really grow, culture human cells and other types of cells, and also organoids in an unprecedented manner, where we can do bioimaging in an unprecedented manner, where bioinformatics, artificial intelligence of genomes have also helped a lot. So a lot of technologies that really helped a lot CRISPR, and specifically the delivery. The delivery technologies that allow to bring CRISPR-Cas into the right cells and right tissues. These technologies have also evolved a lot the past 20, 30 years, and specifically the past 10 years when we know what to deliver. So it's an exciting field of technologies.
So we are having larger and larger toolbox.
Exactly.
We started with a hammer, and now we have all the possibilities.
It's a genetic toolbox.
Thanks to science. It was Brian Cox who said, one of the fundamental foundations of our society is science. We are going to deal with the big challenges that we face, but we have to at least agree on the basis of facts that underpin our response. How can we achieve that? Trusting science.
Trusting science. So it's all about really trusting science, trusting the scientists, understanding the urgent need to continue to support academic research specifically, because this is always the academic research institutions, universities, that are the structures where scientists receive their early training. The urgent need to attract a young generation of scientists, and also a young generation of scientists who will continue to teach at the university, to continuously transfer the knowledge to the upcoming generations, and the necessity to trust the science, but also to consider that our daily life is all about science. The phones we are using, the cars, even the bicycles, everything we are using, it's all about science. All the development of the industrial world in the 19th century, even before, it's all about science and scientists. And all the innovations that are, coming up more and more every day in the world, have really their sources in really the fundamental science.
You have been advocating science for decades. What's your piece of advice? How to deal with a politician who does not trust in science, denies the data prepared by science?
The question is also for me whether they deny it completely or whether they would like the people to deny it, because it's also, a tool for, let's say, maybe propaganda, or a tool to simplify the world, But I don't know, I hope, and this is always very, very difficult, right? Also because the scientists are not always, advocating enough science. The scientists, they like to be in their labs. It's a competitive field. They have to struggle, and they maybe don't have the time to advocate science for the public, and they don't take the time, and they feel that they don't have this talent neither. And the media also have their responsibilities to not highlight enough the science. The politicians de facto maybe don't understand fully the science, and de facto have a lot of also concerns that are the concerns of the people, which is often reduced to, am I going to have enough money to, you know, buy my food, buy my clothes, etc., etc. So it's a little bit a vicious circle, but I think it can be really helped, I believe, through the communication and the media. I think with regard to the politicians, in a way, what you said, it's for me also the responsibility of the media. The politicians, you know, can or may want to transfer certain messages, but if the media transfer heavily, you know, those messages, instead of maybe, because the media have the possibility to control actually, you know, the information, the flow of information, if they were giving, you know, more resonance to the science and maybe less resonance to this, let's say, these comments from politicians, maybe also the public will be, you know, in a way the media have the responsibility to educate, you know, the public, and the politicians have a responsibility to really, you know, to also in a way not take the population for, you know, people who are not educated. This, I think, it's obviously extremely disturbing. And this is not only disturbing, but this is this may have, you know, huge consequences for the future and our future.
So the piece of advice would be: do not replay the words of a science denier who is a politician.
Exactly.
Rather invite a scientist to explain what the facts are.
Exactly.
What's the responsibility of private sector, of private companies towards science?
Yes, so ESET, for example, is a very good example of a private company which has a foundation which really believes that, you know, its role is to really advocate science for the public, also for the kids. There was this morning an event, ESET for schools. And I think it's remarkable that a private company can also invest funds to really advocate science for the public, because it's not a lot of companies are doing so, actually, as a matter of fact. And in nowadays, it's, you know, where we fight for truth, it's more and more, you know, critical and important.
Brian Cox said, quote, "It doesn't matter if you are very important or you think that you are very important. It doesn't matter if you are the president or prime minister or king or queen. It makes no difference. If your opinion disagrees with nature, it's wrong, and you will be found out." Who should find out that the politician, the queen or the king is saying something that is not true? Who should be the one who will point it out?
The ones who should find out, I believe, I hope, and this again relates to education and communicating science to the public, because I believe that the public should be educated enough, or should have the chance to have enough common sense to detect
that he or she is lying.
Exactly. Now, as we know, in our world of increased social media, there is also manipulation of the social media, which lead to emphasizing the wrong messages, the false messages versus the truth.
We know
this is also something that has to be, you know, followed very thoroughly.
We know that it's easier to spread lies than to spread the truth. We have research covering that. You mentioned the young generation, and concerning the young generation, I know that you have high hopes for young generation, and that you also say that it's a hard time for them to live in the world with so much information, such a huge amount of information around them. How to navigate in this world? What would be your piece of advice to the young generation?
I think it's very challenging for them to be constantly, for sure, unless they will, you know, put their phone or tablets aside, to be constantly, how do you say, harassed by multiple information coming from different directions, and you know, I think I'm not sure that we are, you know, as kids, naturally set to develop, you know, a way to figure out what to take in, what to take out, how to select. So I believe that for sure at schools, you know, this should be tackled very early on. You know, teaching kids to deal with the flow of information. But you know, the advice it's always to, in a way, be very critical to what they take. Be very critical. Develop a sense of analysis. Trying to find out what is true, what is not true, what is good, what is not good. And this requires as well sometimes to spend some time on the tablets. I think it's maybe, you know, one can learn a lot, but put the tablets aside and discuss with the parents, discuss with a teacher, ask questions, trying to help them ask, you know, how can I deal with it? Is it, you know, how do I deal with this flow of information? Is it true? Is it not true?
What's real?
This is what's real. And yeah, it's a huge, you know, it's a huge responsibility for the parents and for the society. It requires a lot of time as well. And I think as well the parents and the society is a little bit, you know, taken by speed, by all this, you know, technology is evolving extremely fast, and specifically the social media, etc. Even us as adults, we are a little bit overwhelmed. We even don't know so much how to deal with it ourselves. So for the kids, it's even more challenging.
In the past, you also mentioned that there is a problem with the attention span of, for example, young students who have trouble to concentrate for a long time.
Yeah.
Is it getting worse?
I think it's getting worse, but I believe that this is also, you know, what schools and parents, you know, most likely have to do. At least at schools, there are some schools where, you know, the students are asked to put their cell phone aside. You know, some others they think that at the lunch break it's good to give, you know, for 15 minutes the cell phone. But it's true that I think it's very critical, but not only for kids, also for us, you know, sometimes to really say, no, we should have our time to dream, to not, you know, be in front of a screen, not be always connected, and be able to also, you know, learn to be with oneself and reflect on oneself. I think this is the way we also build ourselves, and we can find trust in ourselves. And so I think it's these are tools and a lot of challenges that the kids have to deal with, but also tools that we have to develop to allow them to deal with what actually at the end of the day we give to them, in which they, you know,
so it's also
they are a little bit victims of
our treatment, you would say. So it's important to learn to do nothing as well.
I think it's important to do nothing, yeah, I believe, to learn to do nothing.
How often are you able to do nothing? You personally?
Actually, I don't know. If I do some, you know, like everyone else, some housekeeping tasks, you do something, but in a way you know, you do without doing, and you know, then for me it's a way to let my mind a little bit, you know, go in other directions. I'm you know, I like to. I'm French, so I like to go to buy my food. I like to cook. I like to bike, to go to, you know, to the supermarkets or the markets, and so I find my let's say my way to think and or not think in that way. I believe a lot actually. I experienced this a lot when I was a postdoc in New York, and after in the different places where I was biking, walking, thinking of something, not thinking. I think it's a very good way to. I think one thinks without thinking that one thinks. That something happens in the mind of the, you know, when one is walking or doing some silly tasks.
the puzzle is being solved.
Yeah, I believe a lot in this. It's a way to regenerate and to set up the clock in a way.
What's your favorite recipe, you, Emmanuelle Charpentier, the cook?
My favorite recipe, I cook very basic, actually. I don't know what is my favorite.
I cook spaghetti with ketchup. What's yours favorite recipe?
No, so something that I don't cook every day, but I like blanquette de veau. So it's a veal blanquette. It's a veal with a kind of white sauce, you know, with rice.
That's your favorite one?
This is what I liked very much
Did you
when
try?
I was a kid, and sometimes I cook it.
Did you try halušky here in Slovakia?
No.
No?
But I think, what is I think I was introduced to it.
You were introduced to it?
So what is exactly it?
It looks white, it's quite heavy, it's good from my perspective. It's not good? Okay. Who said that?
Okay.
So you will have to give it a try.
Mm-hmm. Very good.
I would like to close up this interview with good in humanity. You said, I think the good of humanity now relies, like forever, in those who have an interest in helping others, that has the potential to change the society. Do we have a lot of good people?
Do we have a lot of good people? Let's say...
I'm not really sure if this is going to be a positive closure.
No, you know, I believe that there are a lot of good people, but I believe as well that the media or the information tends to focus on those who are not very good. Obviously, we are victim of people, you know, individuals who are obviously not good and can really change the world in a very dramatic manner. Let's put it that way. When I see the young generation, I feel that, you know, these are young individuals who want to have a happy life. I mean, I don't think they want to deal with war. Mm-hmm. At least in our privileged world, mm-hmm. right? I think they are very excited in you know, actually what they see on their cell phones, right? Which also relates to, you know, technologies, etc. And I believe that, let's say, education and research, mm-hmm. for example, can really attract a young generation willing to make the difference and for the good of humanity. Mm-hmm. I hope that, you know, for sure, I'm certainly not naive, but I think it's important that the society, knowing that the society is always at risks of wars, of dealing with movements of people trying to trigger, mm-hmm. you know, the bad and etc., that we have an effort in trying to, you know, select or, let's say, bring the young generation to good endeavors, mm-hmm. and to inspire the young generation to do good for the planet. I think right now, they see a lot of challenges, and I believe that they feel that, you know, we have left a world that is not in a very good stage, and I think they understand that they have a responsibility for it, mm-hmm. and I hope that there will be enough of the, you know, young talents to really bring the world in a very good direction.
What's the final word? One thing that all of us should remember from Emmanuelle Charpentier?
I think it's what we mentioned: trust science, trust the scientists. I think they have changed the world over centuries and centuries, and they will continue to do so. And always with the leitmotif to do the good for the society and humanity.
Says Emmanuelle Charpentier. Emmanuelle, thank you very much for joining us. Thank you very much for being here with us in the theater or online. And please Science is here to help us out. Good evening to you all.
Thank you.